When Melody Calero was just 10 years old, her life changed forever when Magdalena Calero became her foster mom. At the time, Melody's life seemed to be spinning out of control.
Wouldn't even go to class. I would skip class, stay in the bathroom all day.
And it hasn't been easy. She has issues and traumas. We understand that. That is a trauma that it takes time, it takes a toll.
Even worse, Melody took to cutting herself, sometimes carving words out to release some of the pain.
Each scar has a memory. I have kill me, and then I have why me, and then I have I hate him, then I hate him, then I have I am broken really big.
Magdalena, now her adopted mom, looks back at the countless times she's seen her daughter Baker-acted by police and taken to a children's crisis center, an inpatient unit that provides intensive crisis therapy.
Many times.
Too many to count.
Too many.
Each time, the pain for this mom also cuts deep.
Because you feel that you were not good enough to help her at that moment.
Making matters worse, they live in the southern end of Miami-Dade County, where there is no children's crisis center. Community Health of South Florida has a crisis stabilization unit, but it's for adults only. Now that presents some major challenges when children present themselves. Let me show you why. It's not the type of environment suitable for kids. So when Melody is Baker-acted here, she's isolated, staff conducts the intake process, and then transfers her to another facility nearly 30 miles away.
That's not fair to the children, it's not fair to the parents and others in the community who need these critical services for children.
Brodus Hartley Jr. is the president and CEO of CHI. The organization is committed to building a 20-bed children's crisis center at its headquarters in South Miami-Dade County.
It will need the total community support.
There are families that travel over 100 miles to find a crisis facility down south for their child. For many working parents, the distance is too much.
I know how it feels to not have your parents come and visit you and you want to see them.
CHI receives about 600 children a year in crisis. This as the nation is facing scrutiny for lack of behavioral health services for kids. It's been highlighted in the aftermath of recent school shootings, increases in childhood suicides, and more.
We're in a crisis mode at this particular time because of a lack of adequate facilities for dealing with people who are at risk to themselves or at risk to others.
Intensive intervention of a crisis facility has saved the life of this high schooler.
If there wasn't any of those crises, any therapy or anything, I would be dead right now.
Today she's engaged in school, her grades are up, this as she sees her smooth arm as a symbol of where she's going, in comparison to the scars of where she's been.
It will be so great if CHI will, expand their services, having children, adolescent unit.
A place where young, fragile lives like Melody can begin to mend.
I'll get there eventually, because everything takes time. Like a flower doesn't grow in a day.
You can help children like Melody bloom. Donate to help make a children's crisis center a reality for the kids of South Florida. Go to chisouthfl.org/foundation or call 305-252-4853.